Good day, my name is Richard Nueva Mahinay from PS Intermercer, and today I will be performing the rectal installation. What is rectal installation? Rectal suppositories are used primarily for their local action, such as laxative and fecal softeners. Systematic effects are also achieved with rectal suppositories. It is important to ensure the suppository is placed past the internal, anal sphincter and against the rectal mucosa. For assessment, you need number one, you need to assess the rectal area for any alteration in integrity. Number two, assess present laboratory values, particularly patient WBC and platelet counts. Patients who are thrombocytopenic or neutropenic should not receive rectal suppositories. Number three, assess relevant body system for the particular medication being administered. 4. Assess patient for allergies. Number 5. Verify patient name, dose, route, and time of administration. Number 6. Assess the patient's knowledge of medication and procedure. 7. Assess the patient's ability to cooperate with the procedure. Rectal installation objectives. Number 1. To instill directly medication or the suppository into the rectal area. For number 2. To provide means for rectal evaluation. Number 3. To obtain desired therapeutic effect. 1. Gather equipment. Check medication order against the original copy physician's order according to agency policy. Clarify any inconsistencies. Check the patient's chart for allergies. Rationally, this comparison helps to identify errors that may have occurred when orders were transcribed. The physician's order is legal record of medication orders for each agency. Note the action, special nursing consideration, and safe dose ranges, purpose of administration, and adverse effects on the medication to be administered. Consider the appropriateness of the medication for this patient. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder and can also be used to educate the patient about the medication. As imagine the equipment that we needed. Suppository, water-soluble lubricant, clean gloves, medication cart. Place medication on a tray or move the medication cart outside of the patient's room or prepare for administration in the medication area. Rationally, organization follows this error-free administration and saves time. Number 4. Transport medications to the patient's bedside carefully and keep the medication in sight at all times. Rationally, careful handling and close observation prevent accidental or deliberate disarrangement of medication. Number 5. Identify the patient by checking the name and identification on the patient's identification band or ask the patient to state his or her name. Finally, identifying the patient ensures the right patient receives the medication and help prevents errors. Number 6. Explain procedure to the patient for rationally to gain cooperation and to allay anxiety. 7. Perform hand hygiene and wear gloves rationally to prevent the spread of microorganisms. Or step number 8. Assess the patient to his or her left side in the same positions. Drape accordingly to only expose the buttocks. Rationally allows for easy access to anal area. Left side decreases chance of expulsion of the suppository. Proper draping maintains privacy. For step number 9, remove the suppository from its wrapper. Apply lubricant to the rounded end. Lubricate the index finger of your dominant hand. Finally, lubricant reduces friction and administration and increases patient's comfort. Number 10. Separate the buttocks with your non-dominant hand and instruct the patients to breathe slowly and deeply through the mouth while the suppository is being inserted. Rationally, slow, deep breaths help to relax the anal sphincter and reduce discomfort. Step 11. Using the index finger, insert the suppository round end first along the rectal wall. Insert about 3 to 4. Suppository must make contact with the rectal mucosa for absorption to occur. Step number 12. Use toilet tissue to clean any stool or lubricant from around the anus. Release the buttocks. Encourage the patient to remain on his or her side for at least 5 minutes and retain the suppository for appropriate amount of the time for the specific medication. It prevents skin irritation, prevents accidental expulsion of suppository, and ensures absorption of medication. Step 13. Perform hand hygiene. Rationally, hand hygiene deters the spread of microorganisms. First step, 14. Assess the patient to a comfortable position. Rationally, this ensures patient comfort. For the 15 last, evaluate patient's response to the procedure and medication. Rationally, the patient needs to be evaluated for any adverse effects for the medication or procedure.